In 1999, I was prescribed ciprofloxacin for a routine infection. Within a month, I had developed chronic fatigue. I fell asleep during the day. I couldn't get enough sleep. I went back to the doctor and asked about what was happening to me, and I even asked if, could this drug be causing this problem? And the answer was an emphatic no. It's not possible.
My surgeon and I went over my medical history, and in passing I mentioned that I had a sinus infection a few years back, and he asked me what I took for that, and I told him it was Levaquin, and he was the one that connected the Levaquin with the 3 tendon ruptures that I had had at that point. I took Levaquin in 2006. Since then, I have had 10 tendon ruptures in 10 years. I have brain damage, I have a neurodegenerative disease, I have cardiac issues, so I have neurological issues, I have seizures.
He was put on the Levaquin, and after the first pill, he started with excruciating pain in his shoulder, and his wrist was virtually purple. We thought it was, just a flu or something coming along with the body aches and pains, but 7 days later on the medication and his whole body was virtually destroyed.
When I found out it was the Quinolone that had pretty much crippled me, I was very upset. I mean, I was an athlete, world traveler, water ski, snow ski, rock climb. I did it all. And then all of a sudden I take this thing that's supposed to help me but become well, and now I can't walk or think, and my body was just breaking down.
Levaquin is a fluoroquinolone antibiotic that is meant for life-threatening infections, but they're often prescribed for things like sinus infections, bronchitis, UTIs, and these medications, this class of antibiotics, is too powerful and too dangerous to take for routine infections. People think that the more powerful it is, the better, because it kills everything. The problem with it killing everything is that it's killing the good bacteria also, so it's making people more sick. We love working with Progressive Medical Center because they are the only ones in the country that specifically treat fluoroquinolone toxicity. They help their patients and they tailor their treatment to the patient, and they don't try to use a blanket approach.
3 years later, and we're still trying to repair his body, but Progressive have just been incredible. They've saved his life. He would not be alive today if it was not for Progressive.